So I'll get you just to introduce yourself.
So, hi, I'm Dale Bayliss. I've been in EMS, I guess, 43 years and RN for about 35 years. And I just basically got into this industry to help people. And once I started, I couldn't quit. So I just keep going every day, just keep getting up and doing what I can. And
Was there any particular call or moment early in your career that really shaped how you view your work?
so basically, what made me go into ambulance EMS is one of my good friends. He got hit riding his bike down the highway. And back then there was only ambulances, really few. So at the end of the day, I'm going, this is crazy. There's nobody in our hometown, nobody in the community towns. The first ambulance came like 60 miles away. So I'm going, you know what? That was the reason I went into EMS. And I said, you know what? I'm going to do it. And I was 16 years old. And I just basically signed up for a course and started taking it. And I was halfway through the course when they realized I was 16, and they said, "Well, you have to be 18 to do the course." I said, "Well, I'm not quitting," so I just kept going from that day on. So it's kind of been interesting, and I guess throughout my career, I've had lots of really cool calls, lots of not so good calls, and some terrible calls. So at the end of the day, you just face what you get, and you do the best what you can.
And you're a nurse too, right? Or
Yeah,
we're a nurse.
I was a nurse just until last year. So I was a nurse for RN for 35 years. And I guess what got me there is the system. And sadly, it became more of treating computers instead of treating people. And to me, I can't do that. I can't. To me, people have to be something. They have to be valuable, treasure. But it's when you see a patient just through a computer, it's not the same. And it's kind of like we're treating a maximum of a certain many problems, and that's it. Well, you and I both know lots of people have lots of problems, and they've lifelong problems, and it didn't just start today. And sometimes we miss that part.
I'd agree. Even working in Emerge, like all the time, you see people that are like, "Oh, I have this problem," and then there's like XYZ wrong with them, and the doctor just focuses on the one thing. Yeah.
But I think if you go down to the heart of it, and if you can fix the basic problems, a lot of other stuff just goes away. And that's where a lot of people miss the boat. And like just recently I had a patient on 35 different meds. Well, there's no way you can take 35 medications and still be healthy. Like it doesn't work that way.
No. And how do they not counteract with each other? You know?
Many years ago, I saw a gerontologist when I worked at the U of A in the Stollery, and he said, "You pick four medications, and that's all they're allowed to have. That's it. You pick four, what they need, and the rest they don't need it." I'm going, agree.
Yeah, that makes sense though. Like everybody takes everything, and I don't know. I feel like people are just sicker in general now, but who knows?
Yeah, and I wonder if sometimes people looking for problems when actually at the end of the day, all they truly need is somebody to talk to. And at the end of the day, it's amazing how the power of just kindness can go so well compared to narcotics. So it's it's like a synergistic effect. It's like, you know what, you just get down to the root of the cause and just say, okay, what's wrong here? And what can I fix today? What can I fix? Okay, let's work on this. You can work on this down the road, and let's just go from there. And I honestly walk into people's houses and say, and I'm smiling and going, well, I can fix most things, but I can't fix a broken heart and I can't fix a muffler. And the rest we can work on.
That's cute. I think I'd like to be saved by you. I don't need an ambulance for anything.
I told many patients over the years, and I said, it's too funny. I said, the only way you can die on me is you have to permission slip signed by God. Otherwise, don't even try.
Oh, jeez. Gosh.
Yeah. But it's like, I think it's the hardest thing is another thing that's missing the boat is the teamwork. And you know what? I've seen it for years. An LPN RN makes no difference to me because to me, I see them all the same. Like I don't see them as a different level. I see people helping people. And whether you're a doctor or a paramedic or a nurse, it does not matter. RT or whatever, it's all part of the team. And there's no reason we can't be team members and we can't. But there's some people are really structured. Well, an RN is that they're the king, the queen, or the king. It's like, no, I don't think so. It's not that way. So, and it comes back to what can we do as a team, and it's a team effort. Sometimes the housekeeper does more good than anybody else.
It's true because they're kind to the patient, and that's all the patient needed.
Yep, that's it.
Mm-hmm.
Yeah.
So switching gears a little bit, mental health for frontline workers is often overlooked. What has your experience been with managing your own mental well-being while on the job?
So up until 2015, I think we sucked at it terribly. And I think from then we've kind of starting to catch up on things. But when I started looking at some of the research I looked at, and like up in 2015, when I started writing my books, I'm going, this is crazy. At that point in time, I had 3 or 4 of my coworkers, which were my paramedic students, committed suicide. And then I started looking at it. Then I started thinking of some RNs, some physicians. And when I did some of the research, there's about 200 physicians a year were killing themselves in the US. 200. It's like
That's
one
crazy.
town lost 7 doctors. And I'm going, this is insane. And it's like, you know what? And people, we used to think it was just, it's people who weren't tough enough. It's like, how tough can you be to see so much tragedy every day, day in and out, and get up and do it again? And what they don't know is the cumulative effect of it and how much it damages. And it doesn't matter how much they say we're going to help you, they don't. And
Yeah.
then the other part is you have to be able to reach out. And when you're hurt bad, you can't reach out. And people don't realize that sometimes you just have to drive to their house, walk into their house, get them, put them in your car, and take them and get them help.
Mhm.
Because they won't go. And they'll say, I think I'm okay, I'm okay. They're not okay.
Yeah.
And then the problem is we've lost so many hospital providers, police, firefighters, volunteers, people that we never thought until it was too late. And you know what? If you look back on almost probably 50 to 80% of them, there were signs there that they were in trouble, but everybody missed it.
Mm-hmm.
And it's like, oh my God. And the one article I read, and it's called Physician Suicide 101. And it's just blows me away. They look at a whole bunch of physicians, student physicians and medical school and stuff. People that are the brightest of the brightest and the best of the best that committed suicide. And it's like, why? You think when the system is there to help, but you know what? It doesn't work because they're reluctant to seek help because they're there they can only see from their side of the bubble, and their side of the bubble tells them that they're there to help people. But once they're into that negative part, they just block out their own evils and badness and just try to help doing good when they have nothing left to give.
Yeah. I've been in that boat. Like I ended up in Edmonton at the U of A hospital because my friends drove me there. They knew that I wasn't okay and they drove me there. And the doctors and nurses literally said to me, well, you're a nurse. You should just be able to deal with it. And I was like, well, that is not good help.
No, and it's wrong, and we see it over time. Well, try this medication for 3 months to see if it helps you. That's not going to work either. Like it's just so much of it goes back to somebody you can trust. You have to build that trust. And even that first meeting you have with one person that's going to help you, whether it's your therapy, your doctor, whatever, you have to have trust. They have to have trust in you that you're going to go home and not kill yourself or harm yourself.
Mhm.
And you have to build that trust and say, okay, I'm going to make you a promise. I'm here to help you, but you have to do me a favor and don't kill yourself because that's how it works.
Mhm.
And people don't realize there's a huge, and you can't just fix this in 10 minutes. Like when you walk into a doctor's, if he's doing speed medicine, he's not going to help you.
Mhm.
And psychiatry is the same thing. It's not something about speed. I saw a psychiatrist and he had no freaking clue what he's talking about, a PTSD, because I guarantee you I had all the signs and symptoms. And when I went to the psychiatrist in Edmonton, he had no freaking clue. He said I didn't meet the criteria, but he was going off old criteria that wasn't even updated. And like he was so old and archaic in his system, he had no clue what was going on. And when you start going, well, I don't know, but I know from me, I'm not me. Like this isn't me.
Mhm.
I know I'm broken and I need help. And when you go for help and they just punch out the door, it's like, nope, you only meet 2 of the 6 criteria. I'm going, that doesn't help me today.
Yeah.
And it's like, and I'm sure in your story, the same thing is like, they know you when you're not yourself. And you know what? Good on them for making you go and taking you there. But the sad thing is the system, even today, there's a lot of systems that they're broken. Like I go to the
Mhm.
Grey Nuns and that scares the crap out of me. I went there last week and there was people all the way out past to the front doors, out into the street, waiting to get in.
Oh, geez.
And I'm going, how can that help people? Like, and people they can't stand there when they're just basically being attacked from all edges. All their sensory input is just blowing like a bomb going off. Like is the
Mhm.
smell, the sound smells, this what they see and hear. They can't do it.
Yeah. Even in Bonnieville, some days there are like days in Emerge where we have patients lined up in our waiting room, and then they go down the hallway and they go down towards lab, and it's always so busy. And
Yeah,
then people get mad at the healthcare workers because it's somehow our fault that the wait times are so long. And it's
yeah,
like, no.
yeah. And then I think we have to look at it, change medicine, how it's completely run,
Mhm.
and residents can't be the gatekeepers. And it can't be the administrators, the gatekeepers either. They have to build a system that works. And
Mhm.
every hospital is different. Bonneville Hospital is different than Cold Lake. Cold Lake is different than U of A, and the U of A is different than the Royal Alex. It's your clientele you get than what you see, walking in and walking out. Like completely different story.
Every hospital is so different.
And that's the problem. They think they can brand them all as one. It doesn't work that way.
Nope.
Never has. No.
Okay, continuing on. So you've written some books based on your experiences. So can you tell me what inspired you to start writing them?
So when I started looking at the history of my paramedic students committing suicide and some of my coworkers, and then one night I had a dream. And this is the weirdest thing I ever had. I had a dream, and it came about the only way to communicate to the world is a book. And I'm going, oh, I'm a grade 10 dropout. I know if I know I got kicked out of English. I got kicked out of French. I got 2% in French, so I didn't win in French.
Jeez.
He didn't like me much, but okay. So I said, I'm gonna do a book. So then I started looking at what do you do to write a book and what I need to get across. And then I thought, well, these are the things I got to get across. I started looking up and going, and I started looking at the people we've lost, the people I work with, and I'm what's going to help them the most. And I thought, well, I have to put it in a book. And my book 2 was actually called Between Life and Death, and it was basically going to be the book to help people. And my whole idea of that book was to hell and back, was to just to go and get them and bring them back. And then I wrote the book and I'm going, it's not going to work because nobody's going to know who that person is. And I thought it has to be me because I'm the only one that they'll follow. So I said, I'm going to do it as me. So I actually rewrote the book to me, but then I had to do my first book to tell my story just to get it the start of the process. And so I published 2 books in 1 year, but it was all to get my second book out. And it was basically, I go to chapter 4, and in chapter 4, my partner gets killed off in an accident. But in true life, she was a narcotic overdose. But I didn't want people to know that she killed herself, but I want him to feel the loss. So I thought, how can I make him feel the loss? I thought, let's just crash an ambulance and have a good crash, and she gets killed, and then from there, it breaks the walls, breaks the barriers, and then it starts building. And that whole book was all about building, breaking people down, opening them up, and then by the end of the book heals them. So that's kind of my book idea for book 2. Book 3, when I did my book 3, the idea there was to make the EMS world better. And the sad thing about that one, it was 2019, and it just getting it out before COVID hit. At the same time, I was going through the worst time of my life. So the book wasn't what I wanted to be, but it was the best I could do at the time.
Mm.
2018, 2019, I went through some of the worst of my life. I didn't want to kill myself, but I didn't want to live either. So my friend came to my house, got me help, and it took me a while to get going. And from then on, my nursing career was basically screwed from one supervisor, and it was terrible. And so that was the hardest part for me. I was going through terrible times of myself, but trying to help people at the same time, knowing that people need help. And then I got through it, and I'm going, you know what? And then I also realized at the time, a lot of people don't want to change. They just want to just basically coast in life to try and get through. But it's like, they don't want to change. It's like, you know what? But the problem is they're on a bad road. And the only way to get off a good road is just somebody has to give you direction and give you guidance. And everybody is different. So what I can tell you, I can't tell somebody else.
Mm.
And the analogy I see one time, and this is just me, I'm triaging some girl, and she sits at the desk beside me. She's really pretty, nice girl. And I said, just let me finish what I'm doing, and I'll help you real quick. She says, okay. So then I turned and looked at her after I got done what I was doing. He said, okay, what's up? And I'm kind of smiling. I'm happy, friendly. She looks at me and goes, I just got raped. I go, shit, because I can't fix that. Doesn't matter what I can do, I can't fix that. But what I can do is get her help and then start the process that day on to get her going the right direction. Otherwise, she goes the wrong way. And that's the problem. And then people don't realize it's that one chance we get to make a difference. And that's it. We get one chance and that's it. Because if she got treated poorly, she could go home and kill herself.
Mhm.
And what happens? And say, you know what? It's just, so we have to recognize that, yep, sure, it's a shitty day, but it can be better if we give them some guidance and some help, or at the end of the day, it gives them somewhere to start with. At the end of the day, and no, we can't fix everything, but we can sure make life a little bit better. So, and then when I got to book four, sorry, it was how to make the emergency medicine world better. And then COVID hit with a bang, so then I had to change my book, and basically, it was still helping people, but it was more about helping people in the emergency medicine side of the world and how emergency medicine works, how it doesn't work, and how the system can fail, and how we can make it better. And I know I got some bad reviews, some people from Google and Amazon and stuff. They said it was repetitive. But the funniest thing and stupidest thing about it, I did that on purpose, because they said unless you see something 2 or 3 times, you won't remember it. So
Yeah.
whenever I wrote my book about helping people, I had to make sure I included it more than once so people could realize. And some people took offense to that. I'm going, but that was that was the reason for the book. And it was to help people and show people from a different angle, because not everybody's going to hear it from one perspective or one way. So then I just went ahead and did it.
Mhm.
And then I had this weird thing. I'm going, I'm not done yet, but I want to do a book that'll blow the world away. And so I made a book called Saving Grace. So my partner is an angel, and I'm kind of not a jerk, but I just tell it the way it is. So if you're a loser, I tell you you're a loser, and just tell you they're smart enough, basically, and that's the way I go, and I just keep on going. So cowboy up, kind of, but in a way, but also, you know what? I'm there to help. So I'm kind of like a somebody that cares, but I care a lot, and sometimes you care too much. But at the end of the day, that one person is here to save the world, and I'm here to save her. And it's actually going to make a huge difference, because people can see that no matter what we see and face, there's always a good on the outside, even with loss. So you can go to a car accident, there can be 5 people dead there that day. And it's some of our worst days, but we can make some good out of that. And it's hard. I worked one weekend at the U of A, and I think we had 4 or 5 kids die that weekend. But out of the 4 or 5 kids, 21 people got organs.
Oh my
So
God.
I'm going, it sucked. That weekend sucked terrible. But I'm
Yeah.
going to look at it. 21 people got organs. I'm going, you know what? There had to be some good out of that weekend. And that's what it was.
Hmm.
So I guess that's kind of a little bit in a nutshell, but so I just kind of started this, and yeah, I've made my share of mistakes. I've made so many mistakes in my life, and I just seem to be on that road too. And I don't know why, but it's kind of my destiny, and I'm going to just keep going. I don't care. Yep. As long as I recognize and I fix what I did wrong so I don't do it again, then it's not a mistake.
Hmm. It's very true. My parents used to tell me that growing up.
Yeah. And you know what? We just have to own it. Like, yeah, we can make we just have to own it sometimes and say, yep. And you know what? Another thing that people don't realize, you can put 3 specialists in a room and they're never going to agree. And
Yeah,
that's so, you know what? You got to pick what's right for you, what's going to work for you, and you got to do it. And that's what's going to help.
I would agree with that. Okay, I got a couple more questions. I'm almost done. Don't worry. I'll let you go and have supper soon.
So that's okay.
Um, okay. What advice would you give to someone just starting out in EMS or any other frontline job?
Well, I just think, you know what? We're going to face some good things, some bad things, and everything in the middle. So guess what? It's up to us to basically make the best out of any situation, and always go with the idea that, you know what, we're helping people. And if you don't forget that, you're okay. The minute you forget that and you're just don't like your job, don't like life, then you're the problem, not the patients. So, and we see that over and over. And we see people that they're not. There's a lot of people will never make a career out of this because they're got in it for the wrong reasons. And it's not about, you can never do this for the money. You can't do it for the benefits. You have to do it for helping people. And when you walk up to somebody, you have to look into their eyes, into their heart, and say, okay, what can I do to fix you today? And you have to mean it. And then what do they need? And they might just need gravel. They need a little bit of IV fluid, and whatever they need. Your job is to just help them and do your best. And some things you can't fix it. And that's another thing we have to realize. We only can fix what's in front of us. If it's not in front of us, it's not ours. So it's not ours to own. So if you do your best and somebody gets down the road and somebody doesn't do their job and somebody dies because of it, that's not on us. We only can do our best, and we point them in the right direction, and we do our best, and that's all we can do. And we're never going to win. And I honestly think sometimes we're not meant to win. When it comes to heaven or hell, I believe strongly, strongly there's a good and there's an evil, and that's it. There's no middle. And when it comes to religion, I say I'm religious, and I honestly think there's hell and there's heaven and earth, but I think the hell is here on earth. Like, honest, from what we see, some of the things we see, I honestly think hell is here on earth, and you have seen it, I'm sure. I saw a kid one day that had more skull fractures than I could count on CT, 6 months old, and she was brain dead, and her parents did it to her. So it's like, it's crazy. So I think that's where it comes down to, is like, you just be in this to help people, and you just basically, you do your job. At the end of the day, you have to shut it off and do your best and say, you know what, I did my best. Today sucked. But admit that, and that tomorrow's going to be a new day, and we start over again.
Mhm.
And you count your wins. And I kind of did something. It was kind of cool. I kind of made this up, and I don't know if you can see it very good, but if you look into this guy here, I did save a lot of people over the years. And when you look at that big red guy,
Yeah.
that's bad, because I actually killed a couple people too.
Oh.
At the end of the day, not my fault. It was just a system. So I kind of went through and how many losses and why, and you kind of look at them, and you know what, you count life, and it kind of goes that way. Because for the longest time, I was always counting the losses. It's like, and then I realized we got to count our wins. Our losses, you know what, they're going to be there, but we can just count our losses, and we're going to have some big, big calls that are going to change us forever. But you know what? That's part of life, and we're going to do it, do our best. And for you, you'll do your best until you can't, and then you get help, and you either pick your path and see which way I can go, because you only can take so much hell before you have to get out,
Mhm.
and that's part of it. It's like, and I think that's where it comes down to. Is like, my advice is for you and everybody else is be a team, work together, and yeah, if you get knocked down, get up, and if you can't get up, somebody needs to help you back up.
That's good advice.
Yeah.
Because you can't get up by yourself.
No, no. And people have to recognize it. And that, I think that's the mistake people are making. People have to realize that you're in trouble and they need to walk over to you. They need to pick you up, knock the dust off, and make sure you're good to go, and away you go. And if you can't get going, they need to pull you a little bit.
Mhm. I'd agree with it. Oh my goodness, my throat is so dry. Okay. Where's the question? Okay. How can leaders in these fields better support their teams when it comes to mental health and emotional resilience?
So the biggest thing is they have to treat everybody, they have to have a built-in system, but they have to be able to work around the system and just know that everybody's individual. So everybody comes from a different background. Some are tougher than others, some are weaker than others, and everybody's needs is different. So they have to have a system where, yeah, my office is open 9 to 5 for normal stuff. But when you're in trouble, whatever, then we need to build a way that you can call me 24/7. And I know if you call me, you need help. And that's where you have to build a system that's going to work. And you have to answer that phone because they may only call you once. And that's if you don't answer, it's too late.
Mhm.
But every system needs something built in. Every system has to have a system that everybody knows and they trust and that they know no matter what, there's somebody going to be there when I call for help. And if I call for help, there's a reason. And then at the end of the day, there's going to be people that are going to abuse some things in life, but we all see that, but we also know that too. So, you know
Mhm.
what? But at the end of the day, you need somebody on your team, and no matter what, you can work 3 days in a row and have 3 terrible days, and the fourth day can be even worse. And it's when you hit your all-time low, where sometimes you know what, you just can't go in. I had one day that I couldn't go to work because I saw the worst two people on the planet on one shift. One was a total, like, he was a pedophile. He was just disgusting, terrible person. Another person was even worse. And I said, there's no way I can go to work tomorrow and have the right mind frame when I just dealt with two people that were just the worst pieces of terrible on the planet. And I'm going, it's terrible. And it's like sometimes you just need that time and space away, and you need somebody to say, okay, you know what? And I called my boss and said, I can't work tomorrow, and this is why. You can call it mental health, you can call it a sick day. I don't give a crap because I'm not going, and I just can't do another terrible thing in today. And that's
Mhm.
what it was. So I think your boss needs to know that and build in a system where, and then as well as you need you time, but you also need somewhere that when you say enough is enough, enough is enough. Mandating people to go to work every day doesn't work. They called me one time, they mandated me, and I was driving a tractor down the road, and I says, well, it only goes 15 kilometers an hour, and I won't be there for 3 days. So do the math. I'm not coming.
Well, I mean, I guess that works.
Yeah. But again, you can't mandate staff. Like, how much can you take out of somebody? Well, your heart is empty and broken. It's empty and it's broken. So guess what? Do the math, and they have to figure out what's wrong with the system. And just getting contract workers is not going to fix the system. And just getting people from other countries is not going to fix the system. We have to build from within. And whether it takes making like a apprenticeship program, and people think off the street, say today you're a nurse and tomorrow you're an LPN, and you're going to do these courses, and then you're going to be an RN, and you're never going to leave this building. Like, we
Mhm.
have to figure a way that's going to work, and we have to make it so people can learn from within and build from within and just keep focusing to be better from within. Because at the end of the day, you can't fix something if you're not willing to change.
Yeah. And I feel like a lot more programs are starting to like branch out and have more across Alberta anyways. Like I know here they're doing a nursing program and they're taking some rooms in our hospital and doing their coursework here from the U of C, I think.
Oh, nice, good, yeah,
Yeah. So I feel like they're just trying to start pushing more people, but I feel also at the same time that like LPNs like me who are stuck in AUPE who are consistently stuck with our union and
yeah.
they're just saying that we're not nurses
Yeah.
is just crazy.
They're wrong because a lot of places the LPNs do more than the RNs.
Mhm.
100%. And I honestly, like, I've done some codes together, and it was one day I can't remember which hospital it was, but I didn't know who the LPN was, the RN was. we were into this code. We worked this poor lady for an hour, and sadly, in the end, she ended up. She was ectopic pregnancy.
Oh, geez.
Yeah. We could not stabilize her. Like, we worked so hard doing everything, double IOs. We give her blood. We did everything. And
Mm.
finally, in an hour, we finally got her loaded in the back of the ambulance. I said, let's take one chance and go. And I said, I need somebody to come with me. So they volunteered a nurse. I got her in the back of the ambulance. As soon as we got her in the unit, she coded. And we brought her back in, and that was it. We lost her. But it was like, that call, I just pointed out, it was to me that we were all the same. I honestly couldn't tell you who the LPNs, RNs was, because everybody's doing everything. Lab techs were there helping. Everybody was helping. Just unreal. And that's the way it needs to work, because everybody needs, we need somebody to be in charge. But at the end of the day, there's no reason a good LPN can't be in charge of an RN, right?
Mm-hmm. Well, especially like the LPNs have been working for years, and then they're training the grad nurses and the unis that are coming into the hospital.
Yeah. But when you think of it now, some of the degree programs, they're not seeing patients till the third year. That's insane.
I saw my patients in my first year.
I know, eh?
Goodness. That was like 6 years ago. Gosh.
Oh, God, eh?
Last question for you is, how can the public better understand and support the mental health needs of frontline workers like yourself?
So what they really need to do is basically they just need to know that we need support locally. Like, we actually saw it with COVID. I think a lot of the communities support us, but we need that 24/7. It can't be just during a pandemic. It needs to be the same focus every day, all the time. For when we reach out and say whether, we're having our emergencies backed up and the waiting room is getting longer, we need people to listen to us, and they basically to be on our side 24/7. And we need them to know that, we can't keep taking the pressures, and being mandated to work doesn't work. We need some way to help the system, and the community has to support it too, and say, you know what, we can't keep harassing the nurses 24/7, and people come to the hospital at 3 o'clock in the morning with a toothache, because you know what, they could have come in the daytime, or they could go to the dentist.
Yeah.
So there's other systems out there that can help support them.
Yeah, I would agree. Thank you so much.
Okay, take care. Nice meeting you again.
Nice seeing you too.
Take care. Okay, bye.
Bye.
Bye, buddy. See you, buddy.